The president-elect says he is almost ready to unveil his proposal to replace Obamacare. Donald Trump told the Washington Post the plan will provide insurance for everybody. He said it is very much formulated down to the final strokes. Mr. Trump also said he would use executive power, if necessary, to replace the Affordable Care Act. Rallies to save President Obama's health care law took place across the country yesterday. Thousands attended one protest led by Senator Bernie Sanders in Michigan.
What we are saying to the Republicans, if you want to improve the Affordable Care Act, let's work together. But if you think you're simply going to throw millions off of health insurance, you got another guess coming.
So what could a plan to replace Obamacare actually look like? Shannon Pettypiece is a White House correspondent for Bloomberg News. Shannon, good morning and congratulations on your new job and new promotion. So when Sean Spicer was here this last hour, he said he couldn't really talk about the specifics because the president-elect is not the president yet. But you've been working this story. What are you hearing on Capitol Hill about what it's going to look like?
So from Republicans in Congress, I'm hearing a lot of the same Republican ideas that they've been talking about for years now. Health savings accounts, getting rid of these essential core benefits that the Obamacare plans have to include, things like birth control, psychiatric care, well visits. They say those are driving up the cost of plans now, and if we got rid of those, it would make it more affordable. They don't like mandates. They don't like the government telling people you have to buy health insurance or employers having to buy health insurance. So those are some of the key things we're hearing. Pre-existing conditions, of course, we keep hearing over and over again. We don't want people with pre-existing conditions not to be able to get care, but getting rid of that is difficult if you get rid of a mandate, because if people have no incentive or no pressure to buy an insurance plan, then they're just going to wait till they get sick. Oh, I have a pre-existing condition, you still have to cover me, and they'll go buy health care then, and that's really a worst-case scenario for health insurance.
Does it reflect any of Trump's values, the kinds of things that he's talked about over the years?
Well, one Trump value that he would like to see included, and he was talking about in the Washington Post article, is lowering drug prices. And that's something that if we think we're going to get a plan through quickly and easily, if Trump goes after drug prices, as he's proposing, which would essentially let Medicare and Medicaid set the price of drugs, that's going to create a very big battle with Congress, because Republicans in Congress feel like this price negotiation, this letting the government set drug prices, goes against their free market values. It might be Trump's values of lowering drug prices, but it goes against their free market values, and they think it's going to hurt business and innovation.
Yeah, but as a consumer, when you hear about low drug prices, you think, yeah, great idea.
Right, and in a lot of countries, they do set the price of drugs. So that's where the controversy is going to come in. It's a very populist idea.
He has really shown a willingness to use the White House, even though he's not there yet, as a bully pulpit against American businesses.
Well, and what I don't know yet, and what we'll obviously find out after January 20th, is how much of this plan is going to be driven by Congress and how much is going to be driven by the Trump administration. Is it going to be the Trump administration sending a plan telling them this is what you need to do, or is it going to be Congress saying, here's the plan, here's the ideas, here's what we agree on, here's a bill, now sign it? And that is also going to determine a lot what happens here, what ideas get included and what ideas sort of get left on the cutting room floor.
Well, lowering drug prices, no doubt everybody agrees on. They will face the biggest and one of the toughest lobbyists in Washington, which is Big Pharma.
Yeah.
Okay, they're the most powerful, other than the NRA, they're the most powerful people in Washington in terms of the lobbying sector. So that'll be a fight worth watching. The second thing is the president-elect is promising insurance for everybody. And I think as reporters and others, the question has to be who is going to pay for this. You can't have insurance. It doesn't come free. Either the government is going to pay for it and taxpayers are going to pay for it, or businesses are going to pay for it, which is what Obamacare was a mandate that businesses pay for it. So which one is it?
Well, Republicans are hoping that they can do that by making health care affordable, by getting rid of some of these required benefits, by improving medical malpractice reform, by letting free market buy insurance across state lines. They believe that if their principles are put in place, they'll lower the cost and people will be able to afford it, or it'll be lower for the government. Now, that's all theoretical. That's an experiment that needs to be tested and played out. But I think that's what they're hoping here.
Yeah, but everybody has access to insurance. Let's be clear.
Yeah.
There is access to insurance. It's whether you can afford it or not. I mean, that's or the type
or
of
you
insurance
want to pay for it.
You can get casualty insurance now. You just have an extremely high deductible, and it's this is the debate, and it's a debate worth having.
And if the government pays for it, it's either Medicare or so-called single-payer system.
Yeah, Medicare.
Right, which we'll see when his plan comes out. We're waiting with bated breath.
Thank you so much, Shannon.